Did you know that colon cancer is the third most common cancer in both men and women in the United States? It's also the third most common cause of cancer-related deaths in this country. According to the American Cancer Society estimates, there will be over 100,000 colon cancer diagnoses this year alone here in the United States. Joining us this morning in our Here Our Roar Healthy Living Corner to tell us more about this prevalent form of cancer is Dr. Alyson, an oncologist at New York Presbyterian Weill Cornell Medical Center. Welcome back to the show. It's good to see you again.
Thank you. Thank you for having me.
Thank you for being here with us. You know, reality is I had no idea that colon cancer was so prevalent, that it was so common in the United States, because what happens is I'm hearing all these colon cancer or colon health commercials on TV and advertising and things like that.
It is very common. A lot of people don't realize that.
And as you mentioned, the colon is the entire large intestine. And so why is colon health so important?
Well, the colon is an organ that enables us to eliminate waste from the body, and it also works with maintaining water balance, with absorbing vitamins, and so that's very important. And so you want to have good health. When there are problems with the colon, people can experience pain, mood problems, everything can happen because it's all related.
And so with regards to colon cancers, what are some of the symptoms?
So the most common symptoms that people experience for colon cancer are a change in bowel habits. So someone can all of a sudden become constipated or also have diarrhea, rectal bleeding that comes out when you go to the bathroom, weight loss, if you have weight loss that happens unexplained, any kind of pain in that area, low down pelvic pain, abdominal pain, those are the most common symptoms.
What causes colon cancer?
All colon cancers start in polyps. Polyps are tissue that forms in the colon, growths of tissue, abnormal tissue that grow and then turn into a cancer. And so what causes polyps to form is that the cells undergo mutations or changes that alter them and making them abnormal cells, and then that leads to their abnormal growth, and then cancer develops.
Is there anything we can do then to prevent colon cancer, or how do we keep our colons healthy?
We can do a lot to keep our colons healthy. We can eat a balanced diet, reduce your amount of red meat intake to less than a pound per week, also reduce alcohol intake, stop smoking. Exercise is a big one. You should definitely exercise. All of those measures will promote colon health. The most important thing to know is that everyone is at risk. Age 50 is when we start to screen people with colonoscopies for colon cancer. So if you have a family history, though, of colon cancer or colon polyps, you want to get a colonoscopy before age 50. But everyone's at risk. Men and women are at risk. It's a disease as people age. So you want to start screening at age 50. Definitely go get your colonoscopy. That's the most important thing.
Is there one group or people who are more susceptible to colon cancer than others?
There are certain families that have colon cancer that run in the families, and these are associated with genetic syndromes. African Americans who have a family history of colon cancer need to be screened earlier, and the recommendation is that they start screening at age 45 rather than age 50, only if you have a family history of colon cancer. Anyone with a family history has to start earlier, and everyone at age 50 has to start screening.
Treatment options.
There are plenty of treatment options. This cancer is preventable. That's the most important thing. If you get a colonoscopy and we find polyps, those polyps are removed and cancer is prevented. That's the key. So our goal should be prevention first and foremost. But if cancer is diagnosed, then we have to treat it. And there are various treatment options. Some people need surgery, some people need radiation, some people need chemotherapy. It all depends on the stage. So I think that once we find out the stage of the cancer, then we have a wealth of treatment options.
Well, I do appreciate you coming on the show and sharing this important information, educating us about colon cancer and colon health as well. Thank you so much.
Sure, thank you.
And if you'd like more information about colon health and colon cancer, simply visit the website cancerconnect.com. And And if you like what you've seen here this morning in our Hear Our Roar Healthy Living Corner, be sure to keep watching because we have many more informative segments to come, all brought to you by Woman Magazine.